A strange feeling that passes by in a moment of unexplained fatigue. A small change in the skin, in the color of the stool, in the taste. You ignore it, thinking it is normal, but what if that is the first alarm bell from a dangerous disease that is silently forming? And today we will embark on a journey together to discover the disease known as the silent killer, pancreatic cancer. A type of cancer that is not noisy, does not create immediate severe pain, but once you realize it, it is often too late. However, the amazing thing is, there are signs, very small changes, that your body has tried to speak up. The question is, did you listen early enough? Today, we will explore together 8 signs that can be SOS signals from the pancreas, a small organ but plays a vital role. And I want you to watch it all the way to the end because timely understanding could save your life, or that of a loved one. Sign 1, digestive disorders and unusual weight loss. When meals become a burden, have you recently found yourself feeling bloated, lacking appetite, or having strange stools? You might think it's just a matter of eating irregularly, but what if your body is trying to warn you of something more serious? The pancreas, though located deep in the abdomen and only about the size of a TV remote, is one of the most important organs in the digestive system. It produces enzymes that help digest fats, proteins, and starches, and helps regulate blood sugar. When a tumor forms here, it can block the secretion of enzymes or block the pancreatic duct, leading to a chain of digestive disorders. The patient will begin to feel persistent bloating even when eating very little, nausea or vomiting for no apparent reason. Stools turn pale, fatty, and have an unusual odor, a sign that the liver and pancreas are no longer working effectively, unintentional. Weight loss, muscle atrophy due to inability to absorb nutrients. Pancreatic tumors directly affect the secretion of digestive enzymes, causing food breakdown disorders, causing food to stay in the stomach for a long time, causing bloating and reduced nutrient absorption. Older people are often subjective, thinking that this is a sign of old age or due to stress. They are afraid to go to the doctor for fear of bothering their children and grandchildren, or think not eating well is normal. And because of that silence, the disease has a chance to progress. Mrs. Linda, 67 years old, living in Texas, used to think that the feeling of bloating and nausea after meals was due to age. She lost 5 kilos in 2 months without changing her diet. When she noticed her stools were pale, sticky, and had a persistent foul odor, her doctor discovered a tumor in the head of her pancreas. Luckily, she got checked out in time. So what are some of the other subtle but dangerous signs? Often mistaken for aging, let's move on to part 2, sign 2. Prolonged fatigue and weakness. When you feel exhausted without knowing why, have you ever slept for 8 hours but still woke up feeling exhausted? It's not just tiredness. It's the feeling as if your body has just gone through a storm without warning. This is not normal fatigue. It could be the silent exhaustion from pancreatic cancer. The tumor not only disrupts the digestion and absorption of energy, but also directly consumes nutrients, as cancer cells compete with healthy cells for survival. This makes you feel weak, dizzy, or even just climbing a few stairs makes your heart pound and your legs shake. Many older people mistakenly believe this is a sign of aging. But if you experience extremely unexplained fatigue, not recovering even after resting, feeling physically and mentally exhausted, then it's time to pay attention. As cancer progresses, it consumes a large amount of energy to feed malignant cells. The body no longer has enough fuel for daily activities. This leads to a state of total energy deficiency, causing both physical and mental stagnation. Prolonged fatigue causes patients to fall into a state of anxiety, lack of confidence, and gradually lose the ability to participate in social activities. They begin to withdraw, avoid meeting people, and sometimes feel like becoming a burden. And if your body is not only tired but also has unusual fevers for no apparent reason, then what is going on inside? Come to the third sign. Signs 3, fever and chills, that are permanent when your body warms up in a silent war. Have you ever felt chilly, even though it was sunny outside? Or experienced recurring fevers with no apparent cause, accompanied by night sweats? You may think you just have a cold, but your body's trying to speak up, and it could be much more serious. When pancreatic cancer starts to attack, it affects not only the digestive system, but also the immune system. When the pancreas is inflamed or has a tumor, it releases inflammatory substances, leading to the body's temperature rising as a self-defense response. This causes patients to have mild to moderate fevers, but they repeat over many days, sometimes accompanied by shivering, night sweats, and uncontrollable chills. As cancer cells spread, they trigger a systemic inflammatory response. The liver and bile ducts can also be affected, causing blockages, further disrupting the body's ability to regulate body temperature. Older people often ignore recurring fevers, thinking they are normal symptoms or changes in the weather. They take a few fever-reducing pills and that's it. But this subjectivity causes missed opportunities for early detection. Ms. Janet, 68, had a low-grade fever for several days. She thought she had a virus, so she took cold medicine at home. But then she started to feel chills at night, sweat a lot, and had a slight stomachache after meals. It was only when she went to the hospital for a general checkup that the doctor discovered that there was a tumor causing pancreatitis and compressing the bile duct. It's hard to believe that something as simple as a low-grade fever and fatigue could be the first sign of a deadly cancer. But that's not all. One of the most underrated but potentially life-threatening signs is blood clots. Let's move on to part 4, signs. 4 unusual blood clots when your flow is blocked without knowing, e.g. slight pain in your calf. A little swelling that you think is due to standing for a long time. But what if it's more than just muscle fatigue? What if it's a silent sign of danger moving through your blood vessels? Pancreatic cancer, in addition to directly attacking internal organs, can also cause a condition called hypercoagulation. This is a phenomenon in which the blood becomes thicker, making it easier for blood clots to form, especially in the deep veins of the legs. And when part of this blood clot breaks off and travels to the lungs, the consequence can be sudden death from pulmonary embolism. Pancreatic cancer cells secrete inflammatory substances disrupting the blood clotting system. Chronic inflammation also damages blood vessels, promoting clotting. These clots may not cause obvious symptoms at first, but as they progress, the patient may experience a sharp, stabbing pain in one calf, mild swelling, a feeling of heat in the area. The skin may be slightly red or even slightly purple in the affected area. In older people, leg pain is often attributed to osteoarthritis or poor circulation. Many people also massage at home or take muscle relaxants on their own, without realizing that a blood clot is silently growing. 3-year-old Harold had a dull pain in his leg after a long car trip. He thought he had been sitting too long and took some painkillers, but on the 3rd day he began to have difficulty breathing and his heart was beating abnormally fast. When he went to the hospital, doctors discovered he had a pulmonary embolism, caused by a blood clot originating in his leg, a tumor in the pancreas, but can cause a heart attack or stroke. That's the real danger level, but the body has another way to speak up, through the liver and gallbladder. Let's continue. The journey with sign 5, abnormal swelling of the liver and gallbladder, a warning sign that is often overlooked. Sign 5, liver or gallbladder, swelling. When the body swells to warn that something is very wrong, when you feel a heavy, full feeling on the right side of your abdomen, do you think it's just because you ate too much or a common stomach?
But what if your liver or gallbladder is swelling, silently bearing the pressure of a hidden tumor?
Pancreatic cancer is located near the bile duct, the pathway that transports bile from the liver to the small intestine. When the tumor grows and compresses this duct, it will cause bile to become blocked. Bile cannot escape and will begin to stagnate in the liver and gallbladder. And like a dammed stream, the pressure will gradually increase until the liver or gallbladder swells abnormally. This blockage not only causes swelling, but also leads to a series of other disorders. The liver no longer filters toxins effectively. The gallbladder accumulates bile, causing inflammation, pain, or even gallstones. Liver cells that are stretched for a long time will gradually weaken, making the body tired, itchy, and hormonally imbalanced. For the elderly, the feeling of abdominal pain is often mistaken for indigestion or bloating. They do not think that the liver and gallbladder may be calling for help. It is only when the symptoms turn to jaundice, yellow eyes, or dark urine that things are more serious. The body is never silent. It's always trying to speak up, with pain, with swelling, with bloating. And that's the next sign we need to pay attention to. Most people ignore it, but it's one of the earliest and most persistent symptoms. It's a persistent feeling of bloating and flatulence. Let's move on to sign 6. Signs 6. Flattening, bloating, and loss of appetite. When meals are no longer a joy, have you ever felt your stomach full and bloated, even after just a light meal? It feels like there is no more room in your stomach, as if you are carrying an invisible weight in your abdominal cavity. And the strange thing is, it keeps happening, and it doesn't go away. For many people, bloating is a small thing. It's caused by eating too quickly, eating spicy food, eating a lot of fat. But if this condition persists, if you eat a little but still feel full, if your stomach always feels bloated, especially after meals, then it's very possible that your pancreas is having a serious problem. When pancreatic cancer forms, the tumor can press on nearby organs, especially the stomach and small intestine. This slows down the digestive process, causing food and gas to stagnate in the digestive tract. At the same time, when the pancreas does not produce enough digestive enzymes, food will not be broken down properly, creating a lot of gas, causing a feeling of tension and bloating for a long time. Many elderly people are subjective, thinking that bloating is due to old age and irregular eating. They use digestive enzymes, anti-flatulence drugs, change their menu. But forget that. That uncomfortable feeling can be a silent warning of a cancer that is silently growing inside. Just a feeling of bloating, seemingly harmless, but can be an important clue to saving a life. And if you have ever experienced a dull abdominal pain spreading to the back, especially at night or after eating, then listen carefully to the next part, because that could be the pancreas's last cry for help. Come to sign 7. Sign 7, dull pain in the abdominal or back. When the pain is not where you think it is, there are pains that are not severe. They don't make you scream, but they creep in every day, smoldering in the abdomen, then spreading to the back like a silent ember burning slowly in the body. Have you ever felt that? One of the subtle but characteristic symptoms of pancreatic cancer is abdominal pain that radiates to the back. It's not the kind of pain that's colicky, nor is it like a regular stomachache. It's an aching, dull feeling that sometimes only appears when you lie down or right after a meal. The pancreas is located deep in the abdomen, close to the spine, and surrounded by many sensory nerves. As the tumor grows, especially in the body or tail of the pancreas, it can press on the retroperitoneal nerve, causing pain that radiates from the abdomen to the back. The pain often increases at night when the patient lies on his back and tends to decrease when he sits and leans forward. For the elderly, abdominal pain or back pain is considered normal due to degenerative spine, eating, or lying in the wrong position. They rarely think it is a sign of cancer. Because of this subjectivity, many people are only diagnosed at a late stage when the tumor has invaded and surgery is no longer possible. Mrs. Elaine, 66 years old, used to have mild back pain every morning after waking up. She thought it was because she slept in the wrong position. But then the pain started to appear more often, especially after dinner. At night, she had to lie on her side, curling up to feel more comfortable. After a period of prolonged pain accompanied by nausea, she went to the hospital. The MRI revealed a 3.8 cm tumor in the tail of the pancreas, pressing on the lower spinal nerve. A dull ache may not worry you right away, but sometimes it is a vital clue to pancreatic cancer. And if your body has been sending out a lot of signals, there is one final, very specific sign that you can check right now, just by looking at the color of your urine. Enter sign 8, the sign that your liver, gallbladder, and pancreas are all sending a warning. Sign 8, dark brown urine. When the body messes, but we ignore. This morning, when you went to the bathroom, did you pay attention to the color of your urine? A seemingly small detail, but it could be the final key to unlocking the secret hidden in the liver, gallbladder, and pancreas. Urine is a faithful mirror of the liver and biliary system. When a tumor in the pancreas grows and compresses, the common bile duct, which transports bile from the liver to the small intestine, bile cannot drain properly. At this time, a substance called bilirubin, which is processed by the liver and excreted in the stool, will begin to accumulate in the blood. And the body, to protect itself, will try to push bilirubin out by excreting it through urine. The result: urine turns dark yellow, even dark brown like strong tea, even though you still drink enough water every day. Hyperbilirubinemia not only affects the color of urine, but also causes a series of accompanying symptoms such as itchy skin, fatigue, pale stools, and later jaundice, yellow eyes. However, the special thing is, dark urine often appears before the other symptoms are clearly manifested. Many people think that dark urine is due to lack of water, taking supplements, or eating salty foods, and they ignore it. But if the urine is still dark despite drinking water regularly, lasting more than 2 to 3 days, then it is no longer normal. The fear of going to the doctor, especially in the elderly, sometimes makes the golden time for treatment pass by without a chance to react. A seemingly small detail, like urine color, can sometimes save a person's life, because the body always speaks up. The question is, are we listening deep enough and early enough? Here are the first 8 signs, small, but they can be the most important whispers your body has ever known. And if you have ever seen yourself in one or many of those signs, then please do not miss the next part, where we will look back at the biggest message, how not to miss the chance to live when the pancreas speaks up. In short, don't. Let the silence kill you. Pancreatic cancer is called a silent killer, not because it leaves no trace, but because we are often too busy, too subjective, or too convinced it will be fine. But remember, a change in urine color, a persistent dull abdominal pain, a little unusual bloating, all can be the first warning. Small, but enough to save a life. So, if you, Diggy, or someone you love are over 50 and have any of the above 8 signs, don't wait. Go see a doctor, get screened, and give your body a chance to live. We made this video not to scare you, but to warn you, because life always starts from the smallest things. If you find this video useful, please share it with your loved ones. Please like, subscribe, because who knows, just one small action of yours or I can save someone. Thank you for staying until the end of the video. Don't forget to subscribe, turn on the notification bell to always accompany us on the journey to protect your health with knowledge, with initiative, and with love for life, because you deserve to live healthy and live fully.